Hey guys, so sorry for the redness. I got super burnt on Memorial Day, but I forgot to give you a little update. Wednesday I went to the doctor's and got blood draw, and positive, negative, I'm at HCG level 1, so that's considered back to normal. So now we just wait for my cycle to start so I can officially start the histopanorgram, I believe it's called, so that they can get some more answers. I have my first official appointment with the fertility doctor today, so I will also give you an update on that once I get out from there. I have no idea what to expect, and Travis is out of town for work, so I'm going to be doing this on my own for today. So I'm definitely nervous, but I feel like today is just going to be getting questions answered in a game plan, which is kind of exciting, but also kind of nerve-wracking because I never thought that I would be in this position. I mean, then again, who of us ever thinks that we are going to go down the route of fertility? So I will keep you posted on what our game plan is and everything that we're doing every step of the way. I will talk to you guys in a few hours. Okay, so I just got done at the fertility appointment. They did a check to make sure that I was negative on certain bacteria because of miscarriages, and they also did an ultrasound. And what was crazy about this ultrasound is they actually found a dimple or some kind of separation in the top of my uterus. So looking from the side, which is this picture, right there, you can see it's all together. But if we look at the view from the top, there's like you can see the two white in the center and then the separation. So day 1 of my cycle, I'm supposed to call the lab or their office and schedule an HSG, which is where they fill my uterus cavity with a dye, and then they take x-rays and they're going to try and see if that'll pop the dimple out, or if I'm going to need a hysteroscopy, which is outpatient surgery where they go in and correct it. I also have to go in on day 21 of my cycle and get a bunch of blood tests to complete my workup, because I've already had so many testing done, but they want me to finish up some more. So I'm gonna get the anti-malarian, sorry, I'm looking down, I'm reading my paper, hemoglobin A1C, lupus anticoagulant panel, progesterone, prolactin. So as of right now, we're just testing under the umbrella of recurrent pregnancy loss. So for now, my stuff is covered at my normal insurance rate. But as soon as we start going towards fertility testing and can no longer call it recurrent pregnancy loss testing, then our insurance shifts and it's going to be a different ballpark. But at this point, we kind of just want to figure out what's going on so that we can be better equipped for when we're ready to start trying. As much as I'd like to say that I'm ready for a baby right now, I can't guarantee that emotionally I'll be prepared or stable for the first 12 weeks. After finding out till about 7 or 8 weeks is when I have my most anxiety. And I know that because the baby stopped growing at about 6 weeks, but our second pregnancy, I was pregnant until about 10 weeks. So as soon as I hit 7.5 weeks, I felt like I was in the clear, but come to find out we weren't, as I talked about in the first video. So far that's an update on where we're at. They're not needing to test Travis anytime soon until we get the results back from this, I guess, bacteria that can sometimes stick around after miscarriages. So I will keep you posted once my cycle starts and we're able to start the journey of fertility treatment and testing. I'm already positive that this time next year I will either be very pregnant or have my miracle baby. I know I said the same thing last year, but I'm just gonna keep to the promise and just keep having hope and pressing forward, because that's all I have to do. All right, bye guys.